key to good health. I'm also very impressed with the fact that breath work is free, it requires no equipment, it's simple, and it's working with something that literally you have right under your nose and many of us never think to make use of. I recommend breath work to almost all patients that I see because, in my experience, stress is a primary cause or an aggravating cause of most cases of illness. And even if people have diseases that clearly have organic physical causes, relaxation can nonetheless benefit them and help their body's healing system work better. And I think that all people in our culture can benefit from learning to relax. And lest we think that we have a monopoly on stress, I want to tell you a story that I think is very interesting. A few years ago, I had a medical student, a woman, a very interesting character who now works in a Buddhist monastery in Nova Scotia. She had become very interested in third world peoples and native cultures and spent a lot of time doing rotations in far-off places before she got her MD degree. At one point, she went off for 6 months to a British field hospital in rural Kenya, where she was one of 4 doctors, serving an enormous population of tribal peoples that had no other access to medical care. She went there with very romantic notions of dealing with exotic infectious illnesses like African sleeping sickness. When she came back, she was very sobered by her experience and told me that 95% of what she saw in that field hospital were stress-related disorders, especially migraine headaches, chronic back and neck pain, and peptic ulcers, and that the most common drugs that she prescribed there were Tagamet and Valium. Tagamet is one of the acid suppressive drugs that's used to deal with ulcers and esophageal reflux. So I conclude from this that stress is not something that's unique to America in the late 20th century. I think that the forms of stress may differ in different parts of the world and other cultures, but I think that to be human is to experience stress. I don't think we can make stress disappear from our lives, but I think we can learn to process it better or to neutralize it so that it doesn't damage our bodies. Of all the techniques that I have investigated for reducing stress and increasing relaxation, it is breath work that I have found to be the most time efficient, the most cost efficient, and the one that most promotes increased wellness and optimal health. In addition, I think that working with the breath can be a very powerful technique to center the mind, to help you work more effectively, to help you deal with all of the challenges that life throws in your way every day, and to really turn your direction away from the material world toward the non-physical world. I'm very interested in where this knowledge came from. If you look around the world, you will find breath work emphasized in many different systems, from martial arts to forms of natural childbirth. And if you try to trace back where this information came from, it seems to me that all roads lead to ancient India. Somehow in ancient India, people discovered the power of breath as a technique for affecting the nervous system, for changing consciousness, and for changing physiology. And I think it's fair to say that that knowledge that came to ancient India has diffused all over the world and taken many different forms. In India, working with the breath is a major component of yoga. It's called pranayama, and the word prana means both breath and spirit and universal life energy. The techniques of pranayama have not been much written down. Often they've been passed on as oral teachings, often esoteric teachings from master to disciple. Occasionally you will find books in English that describe basic techniques of pranayama, and all of them begin with warnings about the dangers of working with breath without the supervision of an expert, a guru. The reasons being, they say, that working with breath can unleash very powerful forces and energies within the body that can unhinge the mind and cause extreme physiological disturbances. I think there may be something to that. I have actually seen a few patients who had first psychotic breaks following doing intensive breath work, unsupervised. So I think it is possible that some of these extreme techniques of pranayama may be dangerous and should not be done without supervision. But I want to tell you here and reassure you that the methods that I'm going to teach you I think are quite safe. These are modifications of pranayama techniques. They are methods that I use myself on a daily basis and have gotten great benefit from, methods that I have recommended to hundreds and hundreds of patients over several decades and have never seen cause problems. I also think that in a way these are very simple essences of some of the pranayama techniques. If you look in the few books on pranayama, you'll see many very complicated breath techniques given there. Alternate nostril breathing, for example, and strange forms of breathing that none of us would normally do. They may have their purposes. I'm not an expert in that field, but what I take from this are very simple methods that you can use to raise the energy of the nervous system, to quiet the energy of the nervous system, to balance the energy of the nervous system, and so forth, and to center the mind. And these are the applications of pranayama that I find most useful. As a medical doctor, I'm very interested in the physiological mechanisms by which breath work can accelerate healing. I think the most important physiological fact is that breathing is the only function that we do either completely consciously or completely unconsciously. There is no other function in the human body that has that aspect about it. You can breathe as a completely voluntary act, or you can breathe as a completely involuntary act. So that breathing is controlled by two different sets of nerves and muscles. There are voluntary nerves and muscles that can activate the system and operate it fully. There are involuntary nerves and muscles that can run the system and operate it fully. As a result, breath is the only function through which you can influence the involuntary nervous system. That is, you can establish rhythms of breathing with your voluntary nerves and muscles that will affect the involuntary nervous system. Imbalances of involuntary nervous system function underlie many common disorders. For example, high blood pressure has as its root overactive sympathetic tone. The sympathetic nervous system is one of two divisions of the involuntary nervous system. The involuntary nervous system is also called the autonomic nervous system. The sympathetic branch prepares the body for fight or flight, for emergencies. It speeds up heart rate, it increases blood pressure, it slows down digestion, it diverts blood circulation away from the surface of the body to the interior. And this is a very logical response. If you're faced with an emergency, the thing that's most important is to maintain blood flow to the brain. If there's any failure in that, you're dead. So the reason the heart speeds up and that blood pressure increases and that blood is shunted away from the surface of the body is to ensure that there will be no interruption of blood flow to the brain. In the same way, the reason that digestion shuts down is that digestion becomes a non-essential function during an emergency as opposed to circulation, for example. The parasympathetic nervous system has exactly the opposite effects. It slows the heart rate, it lowers blood pressure, it increases blood flow to the skin and surface of the body, it increases movement of the digestive organs. Normally, these two systems work in balance, and there is a back and flow ebb of dominance of sympathetic and parasympathetic nervous system appropriate to the situation. But it appears that in many of us today, there is overactivity of the sympathetic nervous system. It's as if the body is reacting constantly to an external threat that never goes away. How we got in this situation, I'm not sure. Perhaps this is a consequence of the way we live today. That is, in very high population densities, with a great deal of emotional stress, with a great deal of noise that may have effect on our nervous system. At any rate, whatever the cause, there is in many people an imbalance in nervous system functioning in the direction of overactivity of the sympathetic nervous system and underactivity of the parasympathetic nervous system. This constant sympathetic stimulation can lead to high blood pressure or to disturbed heart function, irregular heartbeats, for example, to cold hands because the skin is deprived of adequate blood. And these disturbances in circulatory function, digestive function, can in turn produce other imbalances in the body. I think there are many disorders that commonly come to doctors' offices which have as their root this kind of imbalance in the function of the autonomic nervous system. In medicine in the West, we don't yet really recognize this as a specific diagnosis, but I was very interested to find that in Japan, the diagnosis of autonomic nervous system imbalance is frequently used, and it's exactly this kind of imbalance that I have described. So it may be that this concept will catch on here among Western physicians as well. A problem is that the way that conventional Western medicine deals with these diseases is not very satisfactory, because instead of getting to the root of the problem, which is the imbalance in nervous system function, we attempt to block the overactivity of the sympathetic nervous system or to deal with its consequences at a more superficial level by giving drugs which are suppressive or counteractive. This is the way we deal with high blood pressure, for example. We give antihypertensive drugs, or for common digestive problems, if there's too much acid secretion in the stomach, we give drugs that block the production of acid. The problem with using this kind of counteractive or suppressive pharmacological intervention is that it increases the tendency of the body to rebound, to react against it. Anyone who has ever used a nose spray to open a clogged nose has observed this effect. Your nose is stuffed up, you spray a chemical in, and magically you can breathe again. But 4 hours later or 8 hours later, depending on which chemical you've sprayed in, there is a rebound effect. The blood vessels dilate and your nose is closed off worse than before. And it's very easy to get into a cycle of dependence on the drug in order to maintain normal function. And every time you attempt to get off, there's this sort of rebound. That's really the same problem that confronts us if we rely on pharmacological suppression of conditions which have as their root overactive sympathetic nervous system activity. The breath work that I'm going to describe to you, and especially the relaxing breath that I will teach you, works to increase parasympathetic tone. So it brings these two systems back in balance. And you can actually observe when people are doing this breath work that blood pressure falls, that heart rate slows, and so forth. So this is getting to the root of the problem. It goes directly to the imbalance in autonomic nervous system function and corrects it. It does not do so immediately. It does so over time as a result of gradual, repetitive input of the right sort of rhythms. But I think that this method of working, although the results may be slower to see, is much superior. Not only does it not have toxicity, it is not working in a suppressive or counteractive way. The results are long-lasting, they get better over time, and of course they're completely free of the toxicity that is usually associated with pharmaceutical drugs. Because breathing can be a conscious act or an unconscious act, it spans those two worlds. Therefore, by focusing attention on breath and working with breath, you are opening the channels between the conscious mind and the unconscious mind. There are many forms of psychotherapy that attempt to do that as well. Classical psychotherapy, which attempts to bring into consciousness through free association of words, for example, repressed memories or emotions, is attempting to gain access to that unconscious compartment. A very simple way to do that is by focusing on breath, so that when you begin to do breath work, you may find